Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client with left-sided heart failure is admitted with shortness of breath. Which assessment finding should the nurse expect? A. Peripheral edema. B. Jugular vein distension. C. Crackles in the lungs. D. Ascites. Correct answer, C. Crackles in the lungs. Rationale. Left-sided heart failure causes blood to back up into the lungs, leading to pulmonary congestion, crackles, dyspnea, and orthopnea. Question 2. Which symptom is most commonly associated with right-sided heart failure? A. Pink frothy sputum. B. Pulmonary edema. C. Bilateral leg edema. D. Persistent cough. Correct answer, C. Bilateral leg edema. Rationale. Right-sided heart failure causes systemic venous congestion, resulting in peripheral edema, jugular vein distension, hepatomegaly, and ascites. Question 3. Which nursing intervention has the highest priority for a client experiencing acute pulmonary edema? A. Encourage oral fluids. B. Place the client in high Fowler's position. C. Restrict activity for 24 hours. D. Offer a high-sodium meal. Correct answer, B. Place the client in high Fowler's position. Rationale. High Fowler's position improves lung expansion and decreases venous return, helping relieve respiratory distress. Question 4. A client with heart failure reports gaining 2.5 kilograms 5.5 pounds in 3 days. What should the nurse do first? A. Reassure the client. B. Notify the healthcare provider. C. Encourage more fluids. D. Recommend vigorous exercise. Correct answer, B. Notify the healthcare provider. Rationale. Rapid weight gain indicates fluid retention and worsening heart failure that requires prompt evaluation. Question 5, SATA. A nurse is teaching a client with heart failure about self-care. Which instructions should the nurse include? Select all that apply. A. Weigh yourself every morning. B. Limit sodium intake. C. Stop taking medications when you feel better. D. Report sudden weight gain. E. Take medications exactly as prescribed. Correct answers, A, B, D, E. Rationale. Daily weights, sodium restriction, medication adherence, and reporting rapid weight gain help prevent heart failure exacerbations. Question 6. Which laboratory value is commonly elevated in heart failure? A. BNP. B. Hemoglobin. C. Calcium. D. Platelets. Correct answer, A. BNP. Rationale. Brain natriuretic peptide, BNP, is released when the ventricles are stretched due to fluid overload. Question 7. Which medication is commonly prescribed to reduce fluid overload in heart failure? A. Furosemide. B. Acetaminophen. C. Metformin. D. Omeprazole. Correct answer, A. Furosemide. Rationale. Furosemide is a loop diuretic that removes excess fluid and reduces edema. Question 8. Which assessment finding indicates worsening left-sided heart failure? A. Clear lungs. B. Oxygen saturation of 98%. C. Pink frothy sputum. D. Warm, dry skin. Correct answer, C. Pink frothy sputum. Rationale. Pink frothy sputum is a sign of pulmonary edema and requires immediate intervention. Question 9. A client with heart failure is prescribed a low-sodium diet. Which food should the nurse recommend? A. Canned soup. B. Ham. C. Fresh grilled chicken. D. Potato chips. Correct answer, C. Fresh grilled chicken. Rationale. Fresh, unprocessed foods are generally much lower in sodium than canned or processed foods. Question 10, SATA. Which assessment findings indicate fluid overload? Select all that apply. A. Crackles. B. Peripheral edema. C. Dry mucous membranes. D. Jugular vein distension. E. Rapid weight gain. Correct answers, A, B, D, E. Question 11. Which position is best for a client with severe dyspnea caused by heart failure? A. Supine. B. Trendelenburg. C. High Fowler's. D. Prone. Correct answer, C. High Fowler's. Rationale. High Fowler's position decreases venous return and improves lung expansion. Question 12. Which medication class improves survival in heart failure? A. ACE inhibitors. B. Antacids. C. NSAIDs. D. Antihistamines. Correct answer, A. ACE inhibitors. Rationale. ACE inhibitors reduce afterload and improve long-term outcomes in heart failure. Question 13. The nurse should instruct a client taking furosemide to eat foods rich in A. Potassium. B. Sodium. C. Calcium. D. Iron. Correct answer, A. Potassium. Rationale. Loop diuretics can cause potassium loss, so potassium-rich foods may be recommended unless contraindicated. Question 14. Which assessment finding should the nurse report immediately? A. Mild fatigue. B. BP 124/78 mmHg. C. New onset confusion and oxygen saturation of 84%. D. Heart rate of 82 bpm. Correct answer, C. New onset confusion and oxygen saturation of 84%. Rationale. These findings suggest severe hypoxia requiring immediate intervention. Question 15, SATA. Which symptoms are commonly seen in left-sided heart failure? Select all that apply. A. Crackles. B. Orthopnea. C. Dyspnea. D. Ascites. E. Peripheral edema. Correct answers, A, B, C. Question 16. Which diagnostic test best evaluates the heart's pumping ability? A. Echocardiogram. B. Urinalysis. C. Colonoscopy. D. MRI of the spine. Correct answer, A. Echocardiogram. Rationale. An echocardiogram measures ejection fraction and assesses cardiac structure and function. Question 17. Which client statement indicates understanding of fluid restriction? A. I'll drink as much water as possible. B. I'll measure all liquids I drink. C. I'll only avoid coffee. D. Fluid restriction isn't important. Correct answer, B. I'll measure all liquids I drink. Question 18. Which finding is expected in right-sided heart failure? A. Pulmonary crackles only. B. Hepatomegaly. C. Pink frothy sputum. D. Severe wheezing. Correct answer, B. Hepatomegaly. Question 19. Which medication decreases heart rate and improves survival in chronic heart failure? A. Metoprolol. B. Ibuprofen. C. Insulin. D. Diphenhydramine. Correct answer, A. Metoprolol. Rationale. Evidence-based beta blockers improve survival and reduce hospitalizations in appropriate patients with chronic heart failure. Question 20, SATA. Which instructions should the nurse include when teaching a client with heart failure? Select all that apply. A. Take medications as prescribed. B. Monitor daily weight. C. Follow a low-sodium diet. D. Stop medications when symptoms improve. E. Keep follow-up appointments. Correct answers, A, B, C, E. Question 21. Which symptom requires immediate intervention in a client with heart failure? A. Mild ankle swelling. B. Fatigue after walking. C. Severe shortness of breath at rest. D. Decreased appetite. Correct answer, C. Severe shortness of breath at rest. Question 22. A client is admitted with acute decompensated heart failure. Which medication is most likely to be prescribed to reduce fluid overload? A. Furosemide. B. Acetaminophen. C. Amoxicillin. D. Aspirin. Correct answer, A. Furosemide. Question 23. Which assessment finding suggests effective treatment? A. Increased crackles. B. Weight loss of 2 kilograms after diuretic therapy. C. Increased leg swelling. D. Increased jugular vein distension. Correct answer, B. Weight loss of 2 kilograms after diuretic therapy. Question 24. Which electrolyte should the nurse closely monitor when a client receives loop diuretics? A. Potassium. B. Calcium. C. Magnesium only. D. Chloride only. Correct answer, A. Potassium. Question 25, SATA. Which findings indicate worsening heart failure? Select all that apply. A. Weight gain. B. Crackles. C. Shortness of breath. D. Increased urine output. E. Peripheral edema. Correct answers, A, B, C, E. Question 26. Which nursing diagnosis is the highest priority for a client with pulmonary edema? A. Impaired gas exchange. B. Disturbed sleep pattern. C. Activity intolerance. D. Risk for constipation. Correct answer, A. Impaired gas exchange. Question 27. Which assessment finding indicates that oxygen therapy is effective? A. Oxygen saturation increases from 86% to 95%. B. Increased crackles. C. Increased dyspnea. D. New confusion. Correct answer, A. Oxygen saturation increases from 86% to 95%. Question 28. A client asks why daily weights are important. What is the nurse's best response? A. They help detect fluid retention early. B. They improve appetite. C. They lower blood pressure. D. They're only needed once a month. Correct answer, A. They help detect fluid retention early. Question 29. Which client statement requires further teaching? A. I'll avoid adding salt to my meals. B. I'll weigh myself every morning. C. I'll call my provider if I gain 2 to 3 pounds overnight. D. I'll stop my medication once I feel better. Correct answer, D. I'll stop my medication once I feel better. Question 30, SATA. A nurse is preparing a client with heart failure for discharge. Which instructions should the nurse include? Select all that apply. A. Weigh yourself every morning at the same time. B. Limit sodium intake. C. Report increasing shortness of breath. D. Skip medications if your blood pressure is normal without provider guidance. E. Keep all follow-up appointments. Correct answers, A, B, C, E. Rationale. These discharge instructions help reduce the risk of heart failure exacerbations and readmission. Daily weights, sodium restriction, symptom reporting, medication adherence, and regular follow-up are key components of self-management. Never advise patients to stop prescribed heart failure medications without consulting their healthcare provider.
Score out of 10. Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.